Rather than saying that stem cells regenerate damaged nerves, it would be more accurate to say that they improve conditions such as vasculitis or inflammation around the nerves, thereby creating an environment where the nerves can function better. In this video, I will introduce the topic of how stem cell therapy can help improve symptoms in cerebrovascular diseases caused by vasculitis of unknown origin. At first, you might wonder if blood vessels can also become inflamed, but blood vessels can indeed develop inflammation. Vasculitis, which is inflammation occurring in the blood vessels, can develop due to infections or inflammation in the vessel walls or as an autoimmune disease caused by abnormalities in the immune system. When the inner walls of the blood vessels narrow, it can lead to impaired blood circulation, which may cause tissue damage or even necrosis. In severe cases, microbleeding can also occur. The most common symptoms of vasculitis include body aches or fever following a cold or infection, as well as abdominal pain, joint pain, or dysfunction of certain sensory or motor nerves. Along with these symptoms, vasculitis is diagnosed through blood tests, imaging studies, or sometimes a biopsy of the blood vessels. Treatment involves steroids and immunosuppressants, but in reality there is a tendency for frequent relapses and repeated cycles of improvement and worsening. Among the treatment options for vasculitis, which can sometimes become a type of intractable disease, I will explain about stem cell therapy. First, regarding stem cells and stem cell therapy, in previous videos I have explained the efficacy and effects of stem cells through various cases over several episodes. Today I will briefly introduce the types of these stem cells. Today, I will introduce a case of adult stem cell therapy used to treat side effects caused by inflammation in blood vessels, known as vasculitis. As shown in the diagram, stem cells can largely be divided into embryonic stem cells, induced pluripotent stem cells, or adult stem cells. Induced pluripotent stem cells are also commonly referred to as iPS cells. I would also like to explain the history of these three representative types of stem cells. But since the content is so extensive, I will organize and present it in a follow-up episode. The stem cells with outstanding differentiation potential, capable of developing into various cells or tissues, are embryonic stem cells and induced pluripotent stem cells. However, embryonic stem cells are limited in practical use due to ethical issues, and induced pluripotent stem cells are not widely used in reality because of concerns about cancer or mutations. On the other hand, although adult stem cells have less differentiation potential and regenerative ability compared to embryonic stem cells or induced pluripotent stem cells, they are much safer and have fewer side effects. For this reason, they are widely used in the treatment of various patients in many countries. In Korea as well, it is legal for individuals to use adult stem cells extracted from their own pelvic bone or fat, as long as the treatment involves only minimal manipulation, separation, concentration, or injection. As a result, the scope of treatments is gradually expanding. Of course, since there are many restrictions on culturing adult stem cells, there are still limitations in actual patient treatments compared to other countries. There are certainly some regrets about this. However, since the implementation of the Advanced Regenerative Bio Act in August 2020, there is potential for a bit more flexibility in culturing and stem cell treatments, but we have yet to feel any significant changes. Returning to the main topic, there are various opinions among scholars and doctors regarding the functions of adult stem cells. Adult stem cells include mesenchymal stem cells, neural stem cells, intestinal stem cells, hair follicle stem cells, muscle stem cells, and endothelial stem cells, among others. So, while most agree on the fact that these cells can differentiate into various types of cells, whether those differentiated cells can come together to form a functioning organ is another matter entirely. In other words, to put it simply, the claim that neural stem cells can regenerate damaged nerves and restore their function is only half true and half false. This is not only the opinion of many stem cell researchers, but personally I also believe that the function of adult stem cells lies more in regulating inflammation or immune functions rather than regenerating tissues. Furthermore, since hematopoietic stem cells, which are the main component of bone marrow, differentiate into various blood and immune cells, I believe they have a clear effect when it comes to immune function. As I explained in the previous video about adult stem cell therapy for autoimmune diseases, the use and application of adult stem cells related to immune function is steadily increasing, especially in Europe. Today as well, based on these mechanisms, I would like to help you become convinced that stem cells definitely have a role in controlling inflammation and improving immunity by sharing a case of stem cell therapy that was used to treat a patient. Let me show you a patient case that I would like to introduce through their story. This is the case of a 58-year-old woman who was diagnosed with vasculitis. She experienced persistent headaches, dizziness, and brain fog, along with unexplained vision and visual field deterioration, as well as sensory and muscle weakness on the left side of her arms and legs. Despite undergoing various tests and treatments, her symptoms repeatedly improved and worsened. If you look at the MRA images taken before treatment for this patient diagnosed with vasculitis, you can see an arrow indicating a blocked blood vessel in the peripheral area of the middle cerebral artery. The finer blood vessels around that area are blocked and barely visible, but after 2 rounds of stem cell therapy and immune enhancement treatment, as you can see on the right, the previously blocked area has reopened, and you can observe the appearance of thin blood vessels around it. Clinically, this patient was diagnosed with cerebral vascular stenosis caused by cerebral vasculitis. After treatment, a significant portion of the symptoms improved. However, I recall that the vision and visual field impairment caused by problems in the central nervous system showed almost no improvement. Rather than just saying that the patient improved, I thought that showing before and after treatment images would lend more credibility to what I'm saying, so I decided to show you the MRA scans. However, please keep in mind that not all patients with cerebrovascular disease experience such treatment effects. This too is based on my own experience and common sense. The most important fact seems to be that taking action as soon as possible is better than letting things sit for too long. Of course, harvesting high-quality stem cells, combining treatments that improve cerebral blood circulation, and therapies that boost immunity can lead to good results. However, in cases where the cerebral blood vessels have been blocked for too long, these treatments often do not have any effect. For example, I think it's a similar principle to placing a stone on a sponge and then removing it. The amount of time the stone was left on the sponge affects how quickly and to what extent the sponge returns to its original shape. In cases like this patient, where inflammation in the blood vessels has led to reduced function of the nervous system around the vessels, the anti-inflammatory and immune-boosting effects of stem cells can be helpful for treatment. That is the conclusion. However, rather than saying that these stem cells regenerate damaged nerves, it would be more accurate to say that they improve conditions such as vasculitis or inflammation around the nerves, thereby creating an environment where the nerves can function better.